Yesterday, like it was an error while making the test video. The topics which we have discussed was in opthal division, and you can see over here there's most of the yeah, uh, common topics which were there. Cycloplegics, okay, the errors of refraction, type of astigmatism. There is something called aphakia signs, where which Purkinje images are absent or present is asked in the question. There are some instruments that were discussed, the like Placido disc or the retinoscope, or more instrument were discussed. And also you can see over here there is conjunctivitis, the types, the bacterial one, the staph aureus is the most common one, the viral, the pink eye, the adenovirus, the most common, the angular due to the gram negative moraxella, there is a diplobacillus. Then there is malnutrition associated, there is plexinular type 4 hypersensitivity, there is a which has an endogenous tubercular protein. The vernal keratoconjunctivitis is the spring cataract. Is a type 1 hypersensitivity reaction. Now, the cobblestone papilla image, it's present in the undersurface of the upper eye. The trachoma type A and C, okay. There is something called Harbor pit and art line. There is in the trachoma, there is grading in the FISTO WHO, which has a different, FISTO, stand for different parts. Now there is ophthalmonium. It's in the first month. Okay, all the causative organism of trachoma and ophthalmonium is because from the chlamydia trachomatis. Okay, now the what is the difference between pinguequela and pterygium? So here is the difference. I think uh, now, yeah, okay. So there is a fatty yellowish triangular present in the linguella, most common on the nasal side is the pterygium. The fatty yellow triangular part is the pinguicuela and pinguicuela, or in the pterygium is basically present like a wing, okay, most commonly in the nasal side. Now, the limbal dermoid site, as you can we can observe, there is inferotemporal quadrant of the limbus uh, of the cornea, and cornea also is present. In the 2024, it was asked about the Hutchinson sign, the Physiology ophthalmicus. In the keratoconus, there is an oil drop sign and Vox stria. Okay, so I'm just reading it. I am not prepared. I have not read, I'm just telling the important points which we have discussed yesterday. You can go through the videos. Just like a morning schedule for me, and just I'm looking at the notes which we have done discussed yesterday. As I have seen that the video didn't recorded the written paper, but it was all clear. So it was a test video. We'll do it better next time, maybe. All right. So. In the now in the kerato, there is vortex keratopathy. Okay, keratopathy. There is a vortex one. This Fabry disease, even present in the amiodaron and chloroquine. It's a wand-like pattern. There is a band keratopathy present in the calcium in the Bowman's membrane of the eye. Okay, make sure this is the Bowman's membrane of the eye. Don't confuse it with the Bowman's membrane of the nephron. Now, xerophthalmia, there is a grading and cataract. Okay, we'll discuss about cataract. So there is different types of cataracts, Morganian in the hypermature, galactosemia, okay, sunflower from the Wilson disease, copper deposition, rosate type in traumatic. The posterior subcapsular is present, corticosteroid induced. That is the most common one. The snowflake is the diabetic one, okay. And there is something called post after cataract or secondary cataract. Okay, so this is very important. I think this is what we have discussed. So I think this video makes the justice.